business entities and the proximity to other licensed tobacco retail outlets across New York City. The results in this study are daunting. If you look at the map right here, and I know it's a little hard to see from the distance, but it's in detail in the report, demonstrate every single licensed tobacco retail outlet that exists in New York City. Citywide, there are 8,992 licensed tobacco retail outlets. On Staten Island, there are 412. In the Bronx, there are 1,542. In Manhattan, there are 2,196. In Queens, there are 2,117. And in Brooklyn, there are 2,725 licensed tobacco retail outlets. There is simply too much tobacco in New York City, and it is causing an oversaturation that must be addressed. To put those numbers in perspective, there are 3 times as many licensed tobacco retail outlets than there are the top 10 corporate chain retailers combined in New York City. That total is 2,984. There are 3.5 times as many retail outlets as there are pizzerias in New York City. There are only 2,500 pizzerias. I think I've been to probably 100 of that 25, so I figure I gotta keep going. There are 3.5 times as many retailers as there are public parochial charter schools and other schools in New York City. There are only 2,619 schools. And while we all like to think that there's a Starbucks on every single corner in New York City, I think there's one there, there's one over there. In fact, there are only 307 Starbucks in New York City. Yet the number, the number of tobacco retailers in New York City is 29 times as many Starbucks as there are in New York City. There is almost a tobacco retailer on every single corner in every block in New York City. Citywide, there is a tobacco retail outlet every 1,312 feet or every 5 blocks. And in fact, when you think about all of the public spaces where there is no retailer, no sort of businesses, nothing, things like cemeteries and parks and beaches, all of those open spaces, when you remove all of those from the equation, the numbers are even less. The bottom line is that there is an oversaturation of tobacco retailers in New York City. There's simply too much tobacco. How does this look on a neighborhood level? How does this look on the local level? In far too many neighborhoods, a child is more likely to walk past a tobacco retail outlet than they will a playground or a library. In fact, there are 342 licensed tobacco retail outlets within 200 feet of a school. 2,909 licensed tobacco retail outlets are within 500 feet of a school. And 6,778 licensed tobacco retail outlets are within 1,000 feet of a school in New York City. Therefore, more than 2/3 of all tobacco retail outlets in New York City are within 1,000 feet of a school. Making matters worse, if you look at the map here, I know it's another one's a little difficult to see from the distance, but it's in the report. The overwhelming majority of licensed tobacco retail outlets are within 1,000 feet of another licensed tobacco retail outlet. In fact, 4,920 of those retailers are within 200 feet of another tobacco retail outlet. 7,843 retailers are within 500 feet of an outlet. And a staggering 8,442 licensed tobacco retail outlets are within 1,000 feet of another outlet. That means more than 93%. Every one of these dots you see are within 1,000 feet of another retail outlet. As you can see, New York City is oversaturated with licensed tobacco retail outlets, and we must begin to turn the tide and reduce the number. There is simply too much tobacco in New York City. Before we discuss our recommendations for the city, I want to introduce a few people to talk a little bit from their perspective. First, we are joined by Dr. Joseph Ravenel, Chief Medical Spokesperson for the American Cancer Society.
In April 2015, Mayor Bill de Blasio announced his One New York plan for a strong and just city. His plan includes a goal to cut premature death by 25% by the year 2040, while dramatically reducing racial and ethnic disparities in mortality. The American Cancer Society and the American Cancer Society Cancer Action Network welcome that goal and look forward to helping the mayor achieve this critically important public health goal. Premature mortality, or death before the age of 65, is closely tied to poverty and a lack of access to critical services. New Yorkers of all racial and ethnic backgrounds share the same leading sources of premature death. Between 2005 and 2014, the 5 leading causes of premature death in New York City were cancer, heart disease, unintentional injury, diabetes, and chronic lung disease. While many factors lead to these causes of premature death, no single factor contributes to premature death in New York City more than the use of tobacco. Tobacco use is the #1 cause of preventable 12,000 people every year, or approximately 33 deaths each day. In addition to lung and bronchus cancer, smoking causes more than a dozen different types of cancer. While lung and bronchus cancer do not account for the largest percentage of cancer cases, they do result in more cancer deaths than any other type of cancer. Nearly 80% of cases of lung and bronchus cancer are tobacco related. This is especially troubling since these cases are preventable simply by not using tobacco. The impact of tobacco use goes well beyond the toll it takes on public health. New York State residents' annual tax burden from smoking-related government spending on health care is about $1,500 for every household in New York State. Countless lives have been saved in the past decade thanks to the leadership of New York City fighting back against tobacco use and cancer. But the work is not done. American Cancer Society Cancer Action Network is issuing this report today in an effort to assist Mayor de Blasio achieve his public health goal by addressing the oversaturation of tobacco retailers that results in children being attracted to smoking and to those already addicted not being able to quit.
Thank you, Dr. Ravenel. I'd now like to introduce Deirdre Scully, Deputy Director of NYC Smoke-Free's Public Health Solutions.
Thank you, Mike, and thank you to our partners at American Cancer Society and American Cancer Society Cancer Action Network. Good morning, my name is Deirdre Scully, and as Mike said, I'm the Deputy Director of NYC Smoke-Free, a program of public health solutions. It is our mission to support local efforts that help to end the devastating tobacco epidemic in New York City. So we stand here today amongst our partners because New York City neighborhoods are bombarded with tobacco, which is still the leading cause of preventable death in the U.S., killing over 12,000 New York City residents annually. In some of our most vulnerable neighborhoods and communities, Tobacco is both persistent and pervasive, making it easier for our young people to pick up the habit and become new smokers, and harder for current smokers to quit. We don't need more tobacco retail outlets in New York City that help to provide easy access to a deadly, dangerous, and addictive product. It is shameful that most kids are more likely to find a tobacco outlet on nearly every corner and every block. Many of these communities are already food deserts void of healthy food. We don't need them to also be tobacco swamps. It's unacceptable. Higher levels of tobacco use and exposure are coupled with widespread availability of this product. New Yorkers deserve better than to live in a tobacco swamp. We can help end the tobacco epidemic by helping to end tobacco proliferation and oversaturation in our communities. Thank you.
All right, thank you so much, Deirdre. Before we wrap up, I'd like to present to you some very specific recommendations that the American Cancer Society Cancer Action Network has for New York City. As Deirdre mentioned, in far too many neighborhoods, tobacco retailers can be found on nearly every corner and every block. And widespread availability of tobacco in our communities dangerously normalizes tobacco use. We must begin to reduce the number of licensed tobacco retailers and end the oversaturation. Based on research around the country and experiences in other municipalities, ACS CAN is calling on New York City to take a few very specific steps. First, New York City must cap the number of licensed tobacco retailers in every single community district at 50% of their current level. Second, New York City must set a minimum distance between licensed tobacco retail outlets and schools, other youth service entities, and other licensed tobacco retail outlets. Third, New York City must immediately restrict licensed tobacco sales within pharmacies or other health institutions. And finally, New York City must immediately include all tobacco products, not just cigarettes, in all licensing rules, and that includes electronic cigarettes. New York City has been a champion of public health for more than a decade, having driven down smoking rates to historic lows and protected our communities from secondhand smoke. Mayor de Blasio, Department of Health Commissioner Mary Bassett, Speaker Melissa Mark-Viverito, Health Committee Chair Corey Johnson, and the Council have been champions of public health. And New York City has been a leader in bold action on behalf of the public. And we look forward to working with them in the coming weeks and months to find the best possible solution to begin reducing the oversaturation of tobacco in New York City. While reducing the number and density of licensed tobacco retail outlets in New York City is not a silver bullet and will not on its own end this tobacco epidemic, reducing the saturation in the number of licensed tobacco retail outlets will save lives, and that is a step we must take. Thank you all very much, and I can answer any questions that you have.
A couple of questions.
Sure.
It might be in here, I haven't had a chance to read it yet, but which neighborhoods have the most retailers, and are there any commonalities as far as the types
Sure.
of neighborhoods that have them?
Yeah, it's so the numbers are pretty fascinating, and they're in detail in there. So the highest concentration, if you look sort of at this, if you look at the map here, the highest concentration of tobacco retailers is actually in Midtown Manhattan. So from around here going up towards Times Square. In Midtown Manhattan, you have approximately 65 tobacco retailers for every 10,000 people. Then if you go down into the financial district, you have approximately 25 tobacco retailers for every 10,000 people. But when you look at more neighborhoods where people live, as opposed to more commercial areas like Midtown Manhattan, it's the areas like the South Bronx and north and central Brooklyn, where the highest concentration of tobacco retailers are. And that is also where you find the highest smoking rates in the city. So if you look at north and central Brooklyn, and you look at the South Bronx, you'll have around 16 to 17 licensed tobacco retailers for every 10,000 people, compared to the citywide average of only around 10 tobacco retailers for every 10,000 people. And those very areas are also the same areas where you have some of the highest smoking rates in the city.
And then I believe there was a bill introduced at the last city council meeting that was about putting a cap on tobacco retailers. Do you know the details of that?
So there has been some legislation introduced, and we are still in the process of reviewing all of it. And we're optimistic that what comes out of the city will be something very positive that we can support. And we're working very closely with the administration and the council to figure out the best thing, because like I said, we're reviewing all of the bills that have been introduced. There have been some stuff for a few years now, but at this moment we can't comment any further on anything that's been introduced.
Okay, but it's not the same as
it potentially is. We just can't comment yet at the moment. Yes, sorry.
Smoking's an addiction.
Correct.
Okay. Retailers, grocery stores, any place other than specific tobacco shops that sell tobacco products only sell them because customers come in and buy them. If you're an addict, you reduce the number of stores that are selling them. They're only going to go elsewhere to get it, just like a regular drug addict. Isn't it better to focus on education of the younger kids, since more and more of them are smoking now, as opposed to the drop-off that we had before, to try and stem it? The retailers aren't getting the customers, they're not going to carry the product.
So it's a combination of things. So the one of the fascinating things that we discovered when looking at the data and really crunching the data from the city, because all of this data is data that the city collects and then we just analyzed it. When you look at the type of smokers there are in New York City, the city defines 3 types of smokers. There are heavy daily smokers. Those are the most addicted because they smoke 10 or more cigarettes every single day. Then there are light daily smokers. Those are people that smoke 1 or less cigarettes each day. And then there are non-daily smokers, people who don't smoke even a cigarette a day. 80% of smokers in New York City are either light daily or non-daily smokers. That means the absolute vast majority, 80%, are not regular smokers. And so therefore, we know that if you make it just a little bit harder for them to access tobacco, more people are not going to make that effort to get it. If it is right there, right outside of their home, right outside of their apartments, right outside of their workplace, they're more inclined to pick up that pack of cigarettes for the first time, or they're more inclined to pick up an additional pack, as opposed to if they have to make a little bit of more of an effort, they're more likely to not. And that's the bottom line. That's why we know a policy like this will work. Now, the key is, like I said, this is not a silver bullet. There are many things. New York City leads a historic effort, as you know, here in New York City, in terms of educating the public and encouraging people not to smoke. And New York City has been at the forefront of that through the Department of Health, and they continue to be. This is one more additional thing that we need to do to help drive down those 12,000 deaths that are lives that are lost every year to tobacco. Any other questions before it starts to rain? All right. Well, thank you all so much. And I just want to say a special thank you to Dr. Joseph Albrecht here. Dr. Albrecht actually created all of the visual maps that you see and everything for the American Cancer Society, and we greatly appreciate all of your work on that. So, and thank you all very much for joining us today. All right, thank you.